Doctors warn, hearing loss in seniors linked to memory decline. If your loved one is a senior citizen with hearing loss, it is important that you watch this video until the end because doctors have recently found a new link between hearing loss and memory decline. And if you know someone who is hard of hearing, make sure to share this video with them so they can take action immediately. So without further ado, let's dive right in. It has been observed that a lot of seniors have difficulty hearing, but most of them don't do anything about it. According to a survey, only 14% of people who need hearing aids actually use them. If you're one of them, then this video is for you. We'll be discussing how hearing loss affects memory and what you can do to prevent it from happening. What's the connection between hearing loss and memory? According to experts, age-related hearing loss can lead to cognitive decline, which may increase the risk of dementia. In fact, studies have shown that individuals who experience hearing loss have an increased risk of developing dementia later in life. However, it's not just about the volume. It's also about understanding speech in noisy environments. The more challenging it becomes to hear and understand conversations, the harder the brain has to work to process the sounds. Over time, this effort may contribute to cognitive strain and potentially accelerate memory decline. A study published in the journal JAMA Network Open found that hearing loss was associated with faster cognitive decline, particularly in executive function and episodic memory. The study followed a group of individuals over several years and discovered that those with more severe hearing loss experienced steeper declines in these cognitive domains. Another study conducted at the University of Michigan used MRI scans to measure brain changes in individuals with normal hearing and those with age-related hearing loss. The results showed that participants with hearing loss had reduced gray matter in areas of the brain associated with auditory processing and memory. Specifically, they observed decreased gray matter in the inferior temporal gyrus and the middle temporal gyrus. These regions are involved in comprehending language and storing auditory memories. But why does hearing loss cause these changes in the brain? One theory is that hearing loss forces the brain to allocate more resources toward processing auditory information. This means that other non-auditory functions such as memory may receive less attention. As a result, the brain areas related to these functions begin to shrink due to reduced activity. Additionally, the constant effort to decipher sounds may induce stress, which can negatively impact cognitive performance and potentially lead to accelerated memory decline. Some research suggests that the link between hearing loss and memory decline might be influenced by genetics. A study published in the journal Scientific Reports identified 3 genetic variants associated with both hearing loss and dementia. These variants are located near genes involved in synaptic transmission and neuronal development, suggesting that they could play a role in the connection between hearing loss and cognitive decline. While genetics can contribute to the risk of dementia, it's important to note that it's not deterministic. Other factors such as lifestyle and environmental influences also play a significant role. Here are some things to keep in mind when talking to a loved one about their hearing loss. Be empathetic and understanding. Remember that hearing loss can be emotionally and socially challenging for many people. Approach the conversation with sensitivity and validate their feelings. Focus on the benefits of addressing hearing loss rather than the drawbacks of ignoring it. Help them see how treating their hearing loss can improve their quality of life, relationships, and overall well-being. Be patient and persistent. It may take time for your loved one to come to terms with their hearing loss and seek help. Continue to offer support and encouragement, but avoid being pushy or judgmental. Suggest specific steps they can take, such as visiting an audiologist for a hearing test or trying hearing aids. Offer to accompany them to appointments or help them find resources and support groups. Celebrate small victories and show appreciation for their efforts. Every step towards addressing hearing loss is a positive one. Acknowledge and celebrate their progress, no matter how small it may seem. Hearing loss can be challenging, but there is hope. With the right support and resources, individuals with hearing loss can lead fulfilling lives and maintain strong connections with those around them. There are several strategies and interventions that can help manage hearing loss and mitigate its impact on memory. One effective approach is to use assistive listening devices such as hearing aids or personal amplifiers. Hearing aids are small electronic devices that are worn in or behind the ear to amplify sounds and make them easier to hear. They can help individuals with mild to severe hearing loss understand speech and participate in conversations more fully. Personal amplifiers, on the other hand, are less expensive and can be useful for those with mild hearing loss. They are not as sophisticated as hearing aids, but they can still help make sounds louder and easier to detect. In addition to assistive listening devices, individuals with hearing loss can benefit from communication strategies and environmental modifications. Communication strategies include techniques such as using visual cues, speaking clearly, and avoiding distractions that can interfere with hearing. Environmental modifications, on the other hand, involve making changes to the surroundings to improve the listening environment. This can include reducing background noise, using visual aids, and ensuring that lighting is adequate. For individuals who are unable to use assistive listening devices or who have more severe hearing loss, cochlear implants can be a game-changing intervention. Cochlear implants are surgically implanted devices that bypass the damaged parts of the ear and directly stimulate the auditory nerve. They can help individuals with severe to profound hearing loss understand speech and can even restore hearing in some cases. While these interventions can be highly effective, it's important to note that they work best when used early. The sooner individuals with hearing loss receive treatment, the better they can adapt and adjust to the intervention. However, it's never too late to seek help. Many individuals who receive treatment for hearing loss later in life report improved communication abilities and an enhanced quality of life. Moreover, addressing hearing loss not only benefits the individuals themselves, but also their loved ones. When individuals with hearing loss receive treatment, it can improve their ability to communicate and interact with family and friends. This can strengthen relationships and create a more supportive network. Furthermore, treating hearing loss can reduce the strain on family members who often find themselves repeating information or speaking louder, which can be exhausting and frustrating. However, it's essential to acknowledge that the decision to treat hearing loss is deeply personal. Some individuals may not want to use assistive listening devices or undergo surgery due to various reasons, including financial constraints, lifestyle preferences, or emotional attachment to their hearing loss. Ultimately, the choice should be made by the individual with hearing loss in collaboration with their healthcare provider. If you or someone you know is experiencing hearing loss, it's important to seek professional help. Audiologists are specialists who can conduct hearing tests, diagnose hearing loss, and recommend appropriate treatment options. They can also provide counseling and support to individuals with hearing loss and their families. To find an audiologist, you can contact professional organizations such as the American Speech-Language Hearing Association. They can provide referrals to qualified professionals in your area. Additionally, many hospitals and clinics offer hearing loss services where you can get comprehensive care and support. Early intervention is crucial in managing hearing loss and preventing further decline. So don't hesitate to reach out to these professionals. Remember, with the right support and treatment, you can overcome the challenges of hearing loss and continue to enjoy a fulfilling and connected life. That's all for today's video. Thank you for watching and supporting our channel. If you found the video helpful, please hit the like button and subscribe to our channel for more informative content about senior care. Don't forget to share this video with your friends and family so they can also learn about the connection between hearing loss and memory decline. We'll see you in the next video.